Hey, my name is Ishan Khan, and today I'm going to be presenting diverticulitis, which is a gastrointestinal disorder. Typical patient presentation. A 65-year-old male presents with acute lower left abdominal pain for the past week. He reports that he's been experiencing constipation for the past few days. He also reports nausea and vomiting, as well as a frequent urge to urinate. He's had a fever for the last few days as well. He's obese and says he does not exercise regularly. He admits to have been a smoker for the past 40 years. What is diverticulitis? To understand what diverticulitis is, there's a couple general terms we have to cover. The first one is diverticula, and these are sac-like herniations of the colonic wall, and they occur most commonly on the sigmoid colon. Diverticulosis, also known as diverticular disease, simply refers to the presence of diverticula. So if you have diverticula, that means you have diverticulosis. But it doesn't necessarily mean that you have diverticulitis, because diverticulitis refers to inflammation or infection of the diverticula, which can be acute or chronic. There are two main types of diverticulitis, complicated and uncomplicated. Complicated refers to acute diverticulitis associated with other complications such as bowel obstruction, abscess, fistula, or perforation. And then uncomplicated refers to acute diverticulitis without an associated complication. Etiology. The cause of diverticular disease is unknown, but aging is considered the main risk factor. However, there are some known possible causes for diverticulitis. One of the possible causes is increased intracolonic pressure. So an increase in the pressure inside of the colon can rupture the diverticula, causing inflammation. And then bacterial infection of the diverticula is also another possible cause for diverticulitis. So diverticulitis is actually a very common disorder. There's about 300,000 cases in the United States per year. And mortality for uncomplicated diverticulitis is very low. Then mortality for complicated diverticulitis is a little bit higher, but still very low, under 5%. And 60% of people over the age of 60 have diverticulosis, and of those 60%, only 4 to 15% develop diverticulitis. Risk factors. The risk factors are pretty much the usual things, such as older age, over 60, low fiber, high fat, and high red meat diet, lack of regular physical activity, obesity, smoking, genetic predisposition, and also certain medications, certain anti-inflammatory medications like aspirin and non-steroidal anti-inflammatory drugs can also be risk factors. Now you might be wondering why certain anti-inflammatory drugs can be risk factors for diverticulitis, and one of the reasons is that these drugs reduce the integrity of the mucosal barrier that lines the GI tract, and this reduction of the mucosal barrier can make it easier for intestinal content to spread to the diverticula and cause inflammation. And then another reason is these drugs can increase intracolonic pressure, which can cause the diverticula to rupture. Now we're going to be going over the pathophysiology of diverticulitis. So oftentimes what happens in patients that have this disorder is that there's a narrowing of their sigmoid colon lumen, and this leads to constipation because there's less room in the bowel for the stool to move through. This may sound unclear right now, but it's illustrated further in the next slide. So this bowel obstruction caused by narrowing of the sigmoid colon causes bowel contents to retreat back into the stomach because they can't pass through the colon and be excreted anymore because of the bowel blockage. So they retreat back into the stomach, and this causes nausea and vomiting. And this is known as complicated diverticulitis. As you can see in this image, the circular muscle layer gets thicker, and this causes the colon lumen to get narrower, which leads to constipation because now there's less room in the colon for the stool to be able to pass through. Now the tinea coli is a smooth muscle that makes up the large intestine, and the shortening of the tinea coli in addition to the thickening of the circular muscle layer can further contribute to the narrowing of the colon lumen. The diverticulitis is caused by a bacterial infection. Fever and leukocytosis can result in order to kill the bacteria. And what rarely occurs is a fistula is sometimes formed between the colon and bladder. And this can lead to urinary problems such as pneumaturia, fecaluria, or dysuria. But this is a very rare form of complicated diverticulitis. As you can see in this picture, a fistula, which you can think of as a tube, connects the colon and the bladder, This can result in several urinary problems such as dysuria, fecaluria, and other urinary problems. But again, keep in mind this is a very rare form of complicated diverticulitis. This is not seen in the vast majority of cases. The most common symptoms of diverticulitis include vomiting, nausea, fever, constipation, lower left abdominal pain, and urinary problems, which are less common. And to quickly reiterate the cause of each of these symptoms, constipation is caused by the narrowing of the colon lumen, which means there's less space in the colon for the stool to pass through. And this can lead to vomiting because now bowel contents can't pass through the colon and be excreted through the anus because they're blocked by the bowel obstruction, they're blocked by the constipated stool. So now what happens is the bowel contents retreat back into the stomach because they need to be expelled through the body somehow. So they retreat back into the stomach and they're expelled through the body through vomit. And the vomiting is preceded by nausea. And fever occurs when the diverticulitis is caused by a bacterial infection. And the goal of the fever, of course, is to kill the bacteria. And lower left abdominal pain is common because diverticulitis is common in the sigmoid colon, which is in the lower left part of the abdomen. And then urinary problems are less common, but they occur in a complicated form, in a rare form of complicated diverticulitis that was explained in the previous 2 slides. So what happens is a fistula, which you can think of as a tube that connects the bladder and the colon. The fistula forms connecting the bladder and the colon, and this could cause the presence of feces in the urine, dysuria, and other urinary problems as well. When it comes to diagnosing diverticulitis, the main factor doctors look for is lower left abdominal pain and tenderness, which is caused by inflammation of diverticula. This is the most common factor they look for because it's the most common symptom reported by patients that have diverticulitis. And again, lower left abdominal pain is common because diverticulitis is common in the sigmoid colon, which is in the lower left part of the abdomen. They also look for an elevated white blood cell level, known as leukocytosis, because it's present in more than half of cases due to fever, which also means half of cases of diverticulitis are caused by a bacterial infection. Again, the goal of the fever is to kill the bacteria that cause the infection. They also perform an abdominal CT scan with oral and intravenous contrast, which is used to rule out other causes for abdominal pain. Treatment for uncomplicated diverticulitis is pretty simple. It's treated non-invasively through the use of antibiotics for 7 to 10 days to treat the infection. The patient may also be assigned a liquid diet for a few days until reassessment of their bowels. Treatment for complicated diverticulitis, however, is a bit more complicated, and it may require hospitalization or surgery to remove obstruction, fistula, or abscess. Here's a list of my references, and thank you for listening.